Good afternoon, Dr. Williams. Uh, Thanks
Nice to see
for
you.
taking the time out of your busy schedule to talk to us here at EUR Web. Please tell me, because you have quite not only just a unique occupation, but a unique story. What led you into wanting to work in cosmetics and plastic surgery as an individual of African descent?
Yeah, so it's a great question. My father was in medicine, and so I was exposed to medicine at a very early age. He originally was part of JPL on the space program, and he kind of decided mid-career to give that all up. He was the ultimate hippie, and thought they were doing things that were too militarily oriented, and went to medical school late in life. And so I kind of saw that process, when I was in my, earlier years, 10, 12. And so I was exposed to medicine early, but in college, I always thought, maybe I would do something with aeronautics or maybe law. But it was really kind of finding the right mentors that to look up to. And that's one of the reasons why I really try to uh, do a lot of talking and speaking about mentorship, especially in the African American community, because we don't have enough mentors. And so that's why these opportunities are really valuable for me.
Mm-hmm. Now, what was the impetus for not only you joining the ASPS, but now you're vice president? Uh, what was the impetus of that? Because it appears just from your accolades that you're very active. A lot of people in your position, they can easily just go about making their money and not being as active as you are. What is the impetus for that?
Yeah, so thank you for the question. I was trained at Yale University. I went to medical school there, and then I also did my plastic surgery training. And one of my mentors was a plastic surgeon named John Persing, and he was the chair program, and he also had leadership roles at ASPS. And what he instilled in us very early was it's not enough just to be a plastic surgeon and just to kind of generate revenue and to do well for yourself. It's important to give back. And he always said, I don't really care how you give back, but that has to be, those are the people I want to train. And that's what I'm trying to instill in you, that it's important to give back. And so the ASPS for me has been a wonderful platform. I've been committee chair throughout, the over the decade that I've served ASPS. I was vice president of aesthetic surgery. I'm currently in my third year as vice president of membership, and I was just notified that I'm going to be slated for the presidency, for president-elect next year, and then on to the presidency. And one of the things that really drove me was we needed more African American leaders as part of ASPS. Plastic surgery, when you think about it, it's not just cosmetic surgery. It's breast reconstruction, it's hand surgery, it's reconstruction from trauma, it's congenital birth defect reconstruction.
That was actually going to be my next line of questioning. Just as you stated, of completing your thought, plastic surgery and cosmetic surgery, it changes lives and not simply for beauty purposes. But however, when individuals, particularly within the African American community, when we think of plastic surgery, we think, oh, well, they want a quote unquote white nose, or they want this or that, rather than, them fixing things that are to their dislike. To them personally, it's oftentimes blown up into, oh, it's a self-hate issue. What do you say to the individuals who aren't aware of the positive aspects of plastic surgery and can only imagine it in a world of Kardashians and so forth?
Right, Rick, it's a great question, and it's a big question. I think the first thing that people have to realize is plastic surgery is more than just cosmetic surgery, that it includes all the things I mentioned before. Traditionally, African Americans are underrepresented as patients because we're not told about the options. And so particularly for breast reconstruction, if you look at the populations that pursue breast reconstruction after breast cancer, African American patients are overwhelmingly underrepresented because Either their physicians aren't telling them about it, or those options don't exist in their communities. And we have to take a leadership role in educating people and changing that. So cosmetic surgery is more than just, the Kardashian types of things. But here's
Yes.
the other thing. And I think that the question about self-hate and, trying to not identify with your ethnicity is a really important one, because traditionally 20 years ago, 30 years ago, there was a lot of that. There's one standard of beauty. There's one thing that we're going for. And if you're getting something done, we're going to make you in that standard. That's really not the way most modern plastic surgeons have been trained and are thinking about things. And so there's this renaissance that embraces ethnicity. And it's important to, I think, for each individual patient to really understand why they're pursuing these types of procedures if they're cosmetic. But they should see it as empowerment, not necessarily that it comes from a self-hate place, but it comes from the fact that I have the right to look the way I feel. And there's nothing more powerful than that. And I think it's something that, again, maybe a little bit underrepresented, that right, that ability to express ourselves has been a little bit underrepresented in communities of people that look like me. And so because of that, I really have tried to take a leadership role to try to change some of that.
Outstanding answer, doctor. Now, what would you say, what needs to be done to spread this idea, because this is a brand new idea, this idea that, plastic surgery is becoming more ethnically aware and ethnically diverse simultaneously, and that, these options are available, to the common man, woman, and woman who, again, as you said, would simply wishes to look how they feel and not necessarily from a place of self-hate.
Absolutely. And so I think the great thing is this is kind of a grassroots thing. I think that while it's great that plastic surgeons are recognizing the importance of identifying ethnicity, of preserving ethnicity, of there not being one beauty standard, I don't necessarily think it's natively coming from the plastic surgeons. I think this is a grassroots thing. I think that people are recognizing that diversity, ethnicity, those are valuable things. And so they're going to their plastic surgeon and saying, don't you dare take away my ethnic features. Here are the things that I really want to change, or here are the things that I want to enhance. And so they're putting those limits and those guardrails, and they're really expressing that it's not one standard of beauty. This is my standard of beauty, and this is what I want you to achieve. And that's such an important conversation, and it's really a radical change. And so it's our job to reinforce that. It's our job to help communicate and support those grassroots efforts, those patients that want to self-fulfill and be self-empowered, and say, yeah, that's the way you should look at it. Don't let anybody tell you what the standard of beauty is.
Outstanding answer, doctor. You've given me a lot of great stuff to work with. Is there anything that I may have neglected to ask you about the ASPS, your involvement, or any of your other works that you'd like for our readership to know about?
Well, I appreciate the question. The ASPS is a great organization. It's been around since 1930s, since the 1930s. And, they are really putting substantial effort into diversity, equality, and inclusion. And I think that just like sometimes people assume that plastic surgery is just kind of cosmetic, superficial things for rich people, sometimes people also think of our industry as one that can't make progress and can't redefine itself. And I will say that the ASPS is doing really great things to encourage leadership positions for, again, people that look like me, to support patients in the African American and minority communities, and to support physicians. And it's all about having some leadership and having role models that people can identify with, that patients can identify with their doctor, future medical students, college students can identify with the leadership in the field. And so I really applaud their efforts, and I'm happy to be part of it.
Outstanding, doctor. Well, thank you very much for your time today on this Thursday.
Of course.
Once we've finished the story, of course, we'll let you guys know. And thanks again, sir.
We appreciate it. Thanks for your time. I look forward to